Hi, I'm Lynn Grodsky, and welcome to this first tutorial for Therapy with a Coaching Edge. If you don't know me, let me introduce myself. I'm a licensed clinical social worker in private practice, and I've been working as a psychotherapist for about 30 years. I'm also a master's certified coach, and I work as a business coach primarily and teach coaching for a large coaching school. Some of you may know me best through my books. I've written a number of books for therapists and coaches about how to build successful practices, all published by Norton. For the past 25 years, I have been operating two separate practices. One is a psychotherapy practice, and one is a coaching practice. And I keep these two practices very distinct. Each one has its own clients and its own methods and policies and procedures. Kind of feels like if you like to garden and I like to garden, it's like having separate garden beds where you don't mix flowers in those beds. So I thought about my therapy practice as being kind of over in this bed and my coaching practice over in that bed. And I liked it that way. But about a decade ago, without consciously planning for this to happen, I began to notice that my therapy flowers were taking on a very rosy hue. Coaching, more specifically a coaching style, was infiltrating the way that I did therapy. And this was not a bad thing because I could notice as a result, sometimes the therapy sessions with this coaching style included were faster in the ways that they moved clients through their issues. And there was kind of a lightness to the sessions. I could talk about a bigger range of topics. I often saw results, and my clients saw results in each and every therapy session. And as a result, retention became a problem of the past. So when it was working this way, when this coaching style was taking effect like this, I really enjoyed coaching skills and strategies morphing into my therapy work. I was pleased, but it didn't always work well. Not all of my therapy clients were happy with this incursion of coaching style into therapy. And I lost a few clients who felt that the direction that therapy was taking was not what they had signed up for, and more importantly, not what they needed. For example, I put a coaching survey from the coaching school that I taught out, a list of very upbeat goals called the Clean Sweep survey. It was out in my waiting room. And a new therapy client came in quite upset, holding that survey in hand and saying something like, "Is this what you call therapy?" And he started to read out the goals to me, and I can understand they did sound pretty strange. They were goals like, "I never rush," "I only have good dreams," "I'm not tolerating anything unpleasant in my life," "My desk is clear of messy papers." And he looked me in the eye and said, "Count me out. I came here to talk about my grief that I'm feeling about losing my only child, and this is not the therapy for me." And he never came back. This was one of the forceful reminders that I had, what I would call a reality check, that sometimes it takes a really good fall to know where you stand. And where I stood was recognizing that I really hadn't done my homework. I hadn't made it conscious and I hadn't made it intentional. I just brought this style in a very organic and instinctual way, and it would work sometimes, but not other times. I felt there and then that I wanted to do more conscious awareness with this. I wanted to have more rigor and more planning and even research in what I was doing when I was bringing a coaching style into therapy. So I started to go through my case files from a decade to think about who benefited from this style and who didn't, to think about what coaching skills were working in a therapy setting and what coaching skills didn't fit at all. And more importantly, looking at the ways that I had adapted and modified a lot of coaching skills for therapeutic purposes and principles. I started to do some research into the coaching literature and into the therapy literature, again, to understand what I was doing. Now, if you know my work, you know that I'm a writer, and it really helps me to write in order to understand what I'm doing. And I started to write about this process. I wrote an article for the Psychotherapy Networker magazine called The Coaching Edge. And in this article, I talked a lot about my journey as a therapist and bringing coaching into therapy and how I'd learned to be a coach. And I looked at some cases that I was working with. This article got a lot of response from readers. And a typical response, a positive response, is one that's here, where a reader said, I've often wondered how to merge the directness of a coach with the tools and knowledge of a therapist. I think we can and must do this to really be good therapists. After the article, I continued to write and to research and to study about this. And fast forward another 6 years to this year, 2018, when I have this new book coming out, Therapy with a Coaching Edge, Partnership, Action, and Possibility in Every Session. The book looks at a model of therapy in 4 ways. First, I show you a foundation that it really is helpful to know so that you don't have the same experience I did of losing clients by bringing this style into therapy. So I show you some what I would call basics, things that I want you to understand. Who's coachable in therapy? What's the right collaborative way to react and act with clients? And then I show you what I call a positioning or a setup, including how do you set up a session so that you can see results in every session, and so can your clients. Then I outline 9 distinct modified coaching skills that I feel like work best in therapy. These are strategies that you can use right away without additional expensive training as soon as you're ready. And finally, I give you a way to think about integrating all of this with your existing therapy process. So this is an additive process. You are not going to replace the things that you already know as a therapist. You can still use all you know, and you can add this in when you want more partnership or collaboration, or more action, or a future orientation, when you want to add that to the therapy that you're doing. And in this brief tutorial, I want to take you through a piece of foundation. One of the basics that is really important when you're bringing things together is to understand what you're bringing together and where it dovetails and overlaps and where it doesn't, and how to make this fit better. So I want to talk to you from a therapeutic point of view, so you can understand what is the difference between therapy and coaching as a therapist sees it. 20 years ago, I remember being at a coaching conference, and there was a small group of coaches who were tasked with creating a position paper to define the difference between coaching and therapy. It's easy, one coach said. Therapy is about the past, and coaching is about the present and the future. Another coach chimed in, yeah, therapists, they're just a blank screen. They don't say anything. They just nod their heads and say, how do you feel about that? Coaches are responsive and they're direct. Another person jumped in and said, oh, therapy takes years, and coaching, it might take weeks or months. I was the only coach in the room that was also an active licensed therapist, and I stood up to protest. You can't reduce therapy to a soundbite. There are over 200 methods or schools of therapy, and therapy is not just one way of working. Therapy is short-term and it's long-term. It's direct and it's open-ended. It's future-oriented and it looks at antecedents and a lot about the history of a person and their past. Therapy is more than you can ever know or quantify, I told them. And please, in your desire to define coaching, don't denigrate therapy. When I started to write this new book, I had to find a much better way to help therapists understand the difference between therapy and coaching, more than these sound bites. And there are some aspects of the two that overlap. But some parts of therapy and coaching really stand in stark difference. And it's so important for you to understand this when you're bringing coaching into therapy. Let me give you a quick rundown from a therapist's point of view. First, starting with who. So the who in terms of therapy and coaching is who's in the room. We know therapists are licensed, master's level at least, and really well educated. And coaches are not necessarily. Coaches need no degree and they don't get licensed and they may not even be certified or having taken any accredited training. Anybody at any time can call themselves a coach as it stands right now. Therapy clients are also very different from coaching clients. Therapy clients often come in with vulnerabilities, degrees of functionality, complex diagnoses, whereas coaching clients, for the most part, are pretty functional, and they're more like what we would call the worried well. This is so important to understand because much of what is considered right for coaching will not translate into what is right for therapy without being adapted. Here's another place where there's some stark differences. We know that in terms of the setting for therapy, we want a contained, confidential, consistent setting. Coaching, not so much. Coaching can and does take place where it can be overheard, or in the lobby of a hotel, in a boardroom, on the phone, on Skype. And confidentiality for coaching is sometimes put in quotes depending on who's paying the bill. You may have to reveal quite a bit about what goes on in a coaching session, like in an executive coaching session with a problem employee if the company is paying the bill. So that's another big difference. Now here's where things start to blur in terms of what's being done. Well, we know that therapy developed, over 100 years ago, and coaching developed maybe 30, 40 years ago. So coaching has borrowed a lot from other professions, including it's borrowed from therapy. Ever hear about narrative therapy? Started about 30 years ago. Well, guess what? Now there's narrative coaching. Somatic therapy. Now there's somatic coaching. Strategic therapy, well, there's strategic coaching. So as a result of this kind of borrowing or blurring of lines, if you were just listening or looking at what a therapist, a strategic therapist, was doing in a session and a strategic coach, it might look pretty similar. One last area that we need to consider is the how of therapy and coaching. Because there's so many schools of therapy, it's really hard to define how therapy is delivered. A lot of it depends on your methodology. And the how of therapy is really hard to put into one sentence. Because if you're a psychodynamic therapist, or if you're a cognitive behavioral therapist, or you're a somatic therapist, or you're a Gestalt therapist, the way that you do therapy is going to be very different from another school of therapy. But if you are a trained coach, if you have gone to an accredited coaching school, if you have been certified as a coach, how you do coaching looks the same as another coach because you are taught and trained to use a very specific coaching style. So there is a singular how of coaching that's recognizable. And this how of coaching is sometimes described by people like Daniel Goleman described it as consistently positive, constructive, motivational, inspiring, and effective. This how of coaching is known in the coaching world as a coaching approach. And you are required to demonstrate a coaching approach in order to get certified by the large certifying body, the International Coach Federation. When I began to do my research into the difference between coaching and therapy, I did a lot of looking around at how to define a coaching approach. And I feel like it can be best understood in the following way. It has 4 aspects. The first, you might call it the field in which the coaching approach operates, concerns the locus of change. Now, let me explain what I mean. In therapy, the locus or the element of change again depends on what method you practice. So if you practice EMDR, you might feel like the locus of change, what causes the change, are the eye movements or the protocol. If you practice CBT, you might feel like the locus of change has to do with the way that a session is set up, including the requirement for homework. If you practice Gestalt therapy, you might feel like the locus of change, the element of change, is that liminal space between therapist and client, that kind of space between the two, and that's where change operates. But if you are a coach and you are using a coaching approach, there is only one place where the element of change or that locus of change resides, and it's within the client. A coaching approach is a client-centered approach. At best, a coach is a facilitator to bring out the solutions that are inside the client. Now, this is an important distinction. This is why coaching clients must be functional, because they have the seeds of that solution inside and it needs to be accessible. As therapists, we might feel like our clients have their seeds too, but a lot of times it's blocked by trauma, by addiction, or by shock, or mental illness, or other complicated issues. But in coaching, in a coaching approach, You look to the client to bring forward the solution to their problems in each and every session. Here's another element. It's partnership in a coaching approach. The metaphor that's most often used to describe the kind of partnership between a coach and a client versus a therapist and a client is the bicycle metaphor. And it goes like this. Imagine that you're learning to ride a bicycle. And if you had a therapist helping you, the therapist might stand to the side and do some observation, ask questions about your difficulty, empathize with your experience as you kept falling, wonder about the past history that you had that was teaching you to put your feet like that or be frightened, or the feelings that you were having. A coach would get on the seat behind you and say, "Where do you want to go today?" That's partnership in each and every session. How do you want to deal with this session? What do you want from this session? How do you want to get there? I'm facilitating this. And again, that's a big difference in terms of partnership. As a therapist, we have a hierarchy in the room. Sometimes we have to make a very hard call with the client. We don't want to flatten that hierarchy too much all the time. Coach, you want that hierarchy to be a lot more flattened or even, so that you can facilitate the next element of a coaching approach, which is action. Action is the hallmark of coaching, and we expect to see action in each and every coaching session. Now, in therapy, you may not want to see action in each and every session. Maybe what you want is for a client to develop insight, because the actions that they're taking are not good actions for them. But in coaching and in a coaching approach, action is front and center. And again, it's because it presumes a functional client, an accessible, available client. The last aspect of a coaching approach is possibility. Whereas therapy may look into history to help someone develop self-reflection, to understand their situation, to tease out problems that they're having, to help them sidestep some very negative patterns and self-sabotaging behaviors. Coaching and a coaching approach stays very present-oriented and future-oriented. It looks out. So these four aspects, a client-centered field, partnership, action, and possibility, need to be happening, need to be occurring in every single coaching session for it to be a true coaching approach. Now you understand why, even though I was trained as a coach and as a therapist, I couldn't just put a coaching approach into therapy with consistently good results, because a coaching approach is not therapy. There are aspects of it I really wanted to capture, but I also needed to respect that in therapy we have ethics and licensure, we have process and principles, we have confidentiality and safety and treatment goals, and we are working with a vulnerable and widely varied population. But as a coach, and if I can modify and adapt these for therapy, I know that I can help Tom get into action, that I can help him see me as a partner and less as an expert, to motivate him and help him want to go forward to these goals, that I can help orient him towards the future more than the past and begin to see possibilities. If only I have the adapted skills that work well in therapy to do this. And the good news is now we do. That's what I've been doing since 2012. I've been working on this model, and it's a model that I want you to have, a model that you can use as soon as you read this book, that you can use whenever you're ready. So I want to thank you for being part of this tutorial today, and hope that you'll follow up and look at some of the future tutorials that I'll be having on my website, therapywiththecoachingedge.com, and that it might be of interest for you to read the book. It's published by Norton and it's out in April 2018. Nice to be with you.